Welcome back to the module 2, that is signs and symptoms of diabetes. So, let's start with the first one, hypoglycemia. What is hypoglycemia? Hypoglycemia is nothing but low blood sugar level that is going to be below 70 mg per dl. So, what are the causes of hypoglycemia? Too little food. Okay, first cause, more than 5 hours from your last meal, for example, you've not had your bedtime snack or a bedtime drink, and then you go into this fasting period, can actually cause to drop your blood sugar level, right? That could be the second cause. Third, too much of insulin or diabetes medication that you've taken. Like, for example, if you miss on the shot of insulin and then you take an extra shot of insulin, that could actually lead to low blood sugar level. Then, too much of physical activity. So even when you're doing, your physical activity is like very strenuous and you've been doing heavy workouts, that can also cause low blood sugar levels. Alcohol, definitely yes. And the onset could be like sudden. You can just get a sudden attack of low blood sugar levels, and if it is not treated, you can actually it can actually be like a fatal condition. So yeah, these are some of the causes and the onset of hypoglycemia. Now, what are the symptoms of hypoglycemia, right? The first symptom is you feel a little bit shivering, like you feel like your body is having that shaking sensation. Okay, so that is the first symptom. Then you start to sweat, like profusely sweat. Okay, you get drenched in sweating, so that is also one of the symptom. Rapid heartbeat, you could actually sense like your heartbeat is really fast. Then headache, you can also have a sensation of like severe headache, something is banging on your head. So that could also be one of the symptoms. Hunger, definitely. Weakness, fatigue, all of these are going to come together. Impaired vision, you sometimes you will not be able to focus on one thing. You will feel that you can it's like a blurred vision that you have, and you can see that you are able to see two objects at one time. So these are some of one of the symptoms of hypoglycemia. You feel a bit anxious, you don't know what to do, you get like panic attacks. So all of these are the symptoms. Irritability, dizziness. So when the person gets any of the symptoms and they are already having diabetes, they are already on insulin or any kind of a diabetes medications, then if you get these symptoms, you have to be very careful. These are the starting symptoms of hypoglycemia. So, what do you do if you are having hypoglycemia, right? First thing that you'll have to do is check your blood sugar level using a glucometer. First thing, right? Second, if you find that the blood sugar level is below 70, eat or drink something that can actually help you to raise the blood sugar level. Like, for example, just a fruit juice, like a glass of fruit juice would work, or a regular soda if you are having an access any nearby place. 1 tablespoon of sugar or honey, then jelly, any kind of a chocolate. Glucose tablets, I would not recommend because we don't know that how much of glucose you take, because these it can cause hyperglycemia also. So you need to be really careful. Glucose tablets, I would say, if you if you speak to a physician and if they tell you to like have it, then it's going to be okay. Otherwise, please avoid the glucose tablets. Or you can just have some biscuits, like any kind of a biscuit, because most of these biscuits, they add a sweetener, right? It's made up of carbs. So anything that has at least like 15 to 20 grams of carbs should be taken immediately. That will help you, right? This is the second step. Third step, check your blood sugar level in 15 minutes. And if you still think that it is still below your 70, you need to repeat the step 2. You need to take more of these items, okay? And then again you need to check, okay? And also you need to eat snack or meal within 30 minutes. And for example, if you're suffering from hypoglycemia, you need to eat a heavy snack in between your meals, because these can cause hypoglycemia. Like, I have seen a few patients who skip their bedtime snack break, like having a glass of milk they skip, and in midnights they sometimes get hypoglycemia attacks, or even in the morning when they check, it's like below 60, their blood sugar level. So be careful with um, you know uh, checking your monitoring your blood glucose level, because it is very, very important. If you actually forgo it, then it can lead to fatal conditions as well. So always carry a 15 grams of carbs in wherever you're traveling, or just put it in your bag, like two biscuits, three biscuits, or just a chocolate, anything that would give you like 15 to 20 grams of carbs. So that is really, really important. Now, let's learn about hyperglycemia. We saw about hypoglycemia. Now let's try to learn and understand what is this hyperglycemia, how can we treat them. So, hypoglycemia, as you know, it's the opposite of hypoglycemia. It is the high blood sugar level that is above 180 mg per dl. So the causes over here is too much of food, opposite of hypoglycemia. Not enough of medication. Like, for example, you skip on your medications, you're not taking enough insulin, and you feel that you forget to take your diabetes, the oral medication. It can cause hypoglycemia, right? And any kind of an illness, surgery, stress, pain, infection, or steroids, all of these can cause hyperglycemia in your body. And the onset for hyperglycemia could be like gradual process. It does not happen like consistent uh, at a go, or in a shock. It does not happen like that. It is a gradual process, right? But if you miss on it, like if you feel that I've got high blood sugar level, and then you have your medications, or you forget to have your medications, it can actually lead to diabetes ketoacidosis. So what is this diabetic ketoacidosis? It's nothing but your body starts to use ketones to produce energy, and that's how there is ketone in your body. Like, ketone starts to develop in your body, and that leads to this condition called as diabetic ketoacidosis, which is again a serious issue. So the blood sugar level here, it is going to be above 180 mg per dl. Now let's understand what are the symptoms of the hyperglycemia. First is nausea. You feel like you want to throw up. Drowsiness. There is blurred vision again. You feel little dry skin. Hunger is there. Extreme thirst is there, and frequent urination is there. So I would say these are the signs and symptoms of hyperglycemia, which is on a gradual onset, right? It does not take it does not take like moments for you to have this hyperglycemia. It takes gradually to show all of these different types of symptoms. So what would you do if you have hyperglycemia? First thing, check your blood sugar level. If your blood sugar is above 250 mg for 2 days, then please call your doctor. Or if it is more than like 150 or 160, that could be because of any kind of a sweet that you've eaten, or that could be because of food activities like overeating. In those conditions, please try to avoid restrict yourself from eating a lot of carbs in your next meal. You can control that in this case. But if you still feel that your body shows that you have more than 250 mg per dl, like for consistently for 2-3 days, then you need to call your doctor right away, because that could be an issue later. What are the complications of untreated diabetes, right? So let's understand this. Here you can see there are different types of microvascular complications, like that affects your blood vessels, your small blood vessels, as the name suggests, micro. So the first one is eyes. That's called as retinopathy. So what happens here is the high blood sugar level can actually damage the tiny blood vessels that is there in your eyes, which leads to vision problems, cataracts, and even blindness. Okay. Then you have associated with your kidney, nephropathy, right? So here what happens is diabetes can actually overwork the kidneys and damage the small blood vessels, which ultimately leads to kidney failure. Right? Then you have neuropathy, which is nothing but associated with the nerves. So high blood sugar damages the nerves, which causes like the pain, tingling sensation, numbness, especially in the feet region. Okay, and this can actually lead to a lot of infections, slow healing wounds, and even amputations. Right. So these are some of the microvascular complications. When you look at the macrovascular, that is nothing but the it affects the large blood vessels, as the name suggests, macro. So here what happens is the first one, brain, stroke or cognitive problems the person might face. So diabetes can actually increase the risk of stroke and memory issues, and that leads to a lot of issues with the brain function of the brain. Second, heart. So high blood sugar can actually raise the risk of high blood pressure and heart attacks. Coming to the extremities, that is your leg and feet, there could be like poor circulation and infections. In this case, what happens is diabetes can narrow down your blood vessels in the legs, which leads to like, because of the narrowing, it leads to like poor circulation. There is like slow wound healing, infections are going to happen, and even gangrene. And sometimes untreated gangrene can also, end in amputation, which is a serious issue. So these are some of the complications of untreated diabetes.